So I'm Whitney Thomas, and I chose communication between the healthcare provider and the patient and with health literacy as my topic. Communication between the patient and the healthcare provider is very important. Patient-provider communication is essential in preventing healthcare disparities. Every day there are errors, readmissions, compromised health status, or other severe outcomes partly caused by miscommunications and misunderstandings in healthcare. Promoting quality communications can help improve transitions from hospital to home, improve patient outcomes, decrease readmissions, which in turn helps reduce healthcare costs. One of the main goals of patient-centered care is ensuring the patient has the best outcome possible. Unfortunately, poor communication often results in poor outcomes, which means patients are more likely to be readmitted within 30 days. Post-discharge communication is also important in improving outcomes, easing transitions, and preventing readmissions. By maintaining post-discharge communications, providers can make sure patients follow their care plans. They can clear up any misunderstandings and answer any questions that the patient may have thought of after they got home. 30-day hospital readmissions are estimated to cost around $17 billion per year and are one of the biggest drains on the U.S. healthcare budget. But they're also one of the most preventable, though there are many other causes of hospital readmission. Miscommunication is one healthcare providers can help prevent simply by communicating more clearly and making sure that their patients understand the information that they've given them. Limited health literacy is a major cause of miscommunication and misunderstandings in healthcare, as well as cultural differences, language barriers, patients feeling rushed and being reluctant to ask questions because they feel that the provider has somewhere else to be. So if the provider asks, do you have any questions, as they're walking out the door, the patient's probably not going to ask any questions they do have because they feel like the provider has somewhere more important they need to be. Cultural differences can also cause serious misunderstandings. An example my clinical ethics professor Robin Bowman used was there was a woman who's in the hospital. Her husband was there with her every day, and when the doctor came in, he was the one who usually talked to him and asked questions that his wife may have had. But on the day the woman was being discharged, he couldn't be there, and the woman was being discharged by a male nurse. So when the male nurse asked if she had any concerns or questions, and the woman just didn't respond, the nurse assumed that she knew everything that she needed to know and let her go. Later in the week, the woman came back with problems because she actually didn't understand the instruction she was given, but explained to a female nurse that her religion prevented her from speaking to men, so she couldn't talk to the male nurse who discharged her or ask him any questions. Health literacy. The Agency for Healthcare Research and Quality defines health literacy as a person's capacity to obtain, process, understand health information and services, and be able to use that information to make appropriate healthcare decisions. AHRQ's national assessment revealed that approximately 36% of adults have serious health literacy skill limitations, and it's easy to see why. There are many barriers in our healthcare system. Language can be a huge barrier that can cause a lot of problems. Translators and interpreters are very important when a patient doesn't speak the same language as their provider, or if that's not their first language. When possible, a professional translator should always be used rather than a patient's family member. Family members may withhold bad news from the patient or accidentally misinterpret critical medical information. When family members translate for each other, they're also more likely to just answer for the person instead of translate it for them to answer, which can be problematic. Studies by Doak and Root have shown that adults typically read 5 or 6 grade levels lower than the last year of education they completed. So an adult who completed 12th grade may actually read at a 6th grade level. This can create huge problems in the healthcare setting when someone's trying to read a pamphlet or instruction sheet or the label on a prescription bottle. Providers assume a lot of the time that since they have a basic understanding of certain medical terms and jargon, that patients are able to understand these terms too, which is not the case. Some complicated but commonly used words in the healthcare setting include annually, hypertension, referral, dermatologist. Instead, we should try to avoid medical jargon and use plain language. So we could use every year instead of annually, high blood pressure instead of hypertension, skin specialist or skin doctor instead of dermatologist. I found an example where jargon became a problem. There was an older man who was in the doctor's office, and the doctor told him that he had hypertension and gave him a prescription for a medication to lower his blood pressure. But when he went out to the waiting room and his wife asked him what the doctor had told him, the nurse overheard him tell his wife that he was hyper and he just needed to calm down. Obviously, this can cause a lot of problems. Fortunately, the nurse was able to clear things up and explain his condition was much more serious than just being hyper. Another cause is complicated instructions. Patients are often expected to complete complicated tasks on their own, which can be very dangerous if the patient doesn't understand the instructions. For example, if a patient is told to take 2 tablets by mouth twice daily with food, the patient may be confused if they're supposed to end up taking a total of 2 or 4 pills per day, which can be very dangerous if they take too little or too much medication. And most people really don't know what with food actually means. The AHRQ found in a study that 46% of adults just did not understand one or more prescription label that they were given, and that 38% of adults who were assessed to have adequate literacy missed at least one label. So, how can we as healthcare managers help to promote clear communication between staff and patients? Since patients often have less face-to-face time with providers today, it is important that we ensure patients have and understand all information they need to know and what they need to do in the little time that we spend with them. Using universal precautions in health literacy can also help prevent many misunderstandings. You can't really tell what a person is or is not understanding just by looking at them. So treating each patient like they may have low literacy skills will help promote clear patient-provider communication, which everyone benefits from. Patients are also more likely to answer open-ended questions instead of yes-no questions. So instead of asking, do you have any questions, we could ask, what are some questions that you have for me? Using visuals like the Wong-Baker faces. Pain rating scale can also help promote understanding between patient and provider. Providers should also look out for red flags or signs of low health literacy in their patients. Red flags may include incomplete or incorrect medical forms that the patients filled out, if they're using their medications incorrectly, or if they've missed a lot of appointments, if the patient hands a written material to a family member to read rather than reading it themselves, or saying that they forgot their glasses and that they'll read it when they get home. If providers are able to identify these signs, they will be able to address the problem and find different ways to make sure that the patient understands the information and knows what they need to do. A strategy to help confirm patient understanding is the teach-back method. It's a tool that requires the patient to repeat what the doctor has told them and what they understood, and it gives the provider an opportunity to clear up misunderstandings or add any information that the patient had left out. So, and this ends with an understanding between the two of them. This helps prevent medical errors, readmissions, compromised health status, and reduce the cost to patients and healthcare facilities. So there are many factors that play into patient-provider misunderstandings and miscommunications, but if we as healthcare professionals put in the time and effort to help close the health literacy gap between patients and providers, we'll likely end up with improved health outcomes and lower costs and better patient-provider relationships. Thank you.